So Scripps has launched a program that honors people who give the gift of life, and they hope that it could inspire others to do the same. They are called Hero Walks, and here to discuss the program are two participants. We have Susan and John Tiefenbrunn, and also the director of Scripps Center for Organ Transplantation, Dr. Christopher Marsh. Good to see all of you. Thanks for coming on the program.
Glad to be here.
Being here.
John, why don't I start with you, because you realized at some point in your life that you needed a kidney. Tell me the story briefly.
Well, you know, I'm working all my life and living good, and I've had diabetes for about 25 years, and I had a few angiograms along the way, and my kidney function deteriorated where I had to I became very sleepy and not very active, and
You were on dialysis for a little while?
and then I was on dialysis for a year, and then the approval process for a kidney donor was long.
At some point, a decision was made that it would be best if you had a kidney. And that's when Susan stepped in and said, Susan, what did you think?
I'm going to give you my kidney. I'll do it.
What was that decision process like?
Instantaneous. It was neat. I mean, you know, I'll give you my kidney. I wanted my husband. It was as simple as that. He was failing, I could see.
Yeah.
And he really needed some help.
And you had to do some tests, I presume?
Oh, my goodness. It took a year. It was 14 months, in fact, and I was actually not approved once. This is an interesting thing. I'm as healthy as a horse, even though I'm of a certain age.
Yeah.
And many states actually don't allow a kidney donor to give a kidney unless they're younger than 62. California is one of the unusual states that allows a person my age. I'm 75. Don't tell anybody.
You're
I told
looking
you this.
good. Looking great.
So I said, I'm going to give you my kidney. And they said, well, wait a minute. You know, this is going to take a little time here. But
Yeah.
So it took a long time. We did all the tests. Everything was great. And then I get disapproved because of a creatinine clearance inadequacy. And I was really devastated. It had to do with the urine specimen. And then I was in a doctor's office in Scripps Green Hospital, and I told him the story, and he said, well, that's ridiculous. Take it again and just drink a lot of water. Drink, drink, drink. I said, oh, I think I can do that. And sure enough, when I resubmitted this urine specimen, I originally got 62 or 42.
Yeah.
42 was on a scale of 100, and I failed the test.
Wow.
And then when I resubmitted the urine specimen after drinking gallons and gallons of water,
Right.
I was 99.
So you did it.
So I did it.
So, doctor, what's the process? I mean, we've got a successful transplant here. What can other people expect?
Well, I think that they're an example of pushing hard, and we worked hard to get her cleared and get the transplant done, and they've done well. They're older than some donors and recipients, but an example of people doing well. And I think the Hero Walk is really to, you know, take a shout out to the donors that are doing something. I mean, we honor our policemen, our firemen,
Sure.
our military, but here's someone that's taking time, effort, donating a piece of their body for someone and really making a difference in someone's life, and it's
I know
really
we have
important.
some video of the Hero Walk, and perhaps we can put that up. For people interested in giving a kidney or transplanting an organ, what would you say to them as we look at kind of the cheering of people going in to donate an organ?
Yeah, we really want to encourage organ donation, and there's over 100,000 people on the list. 18 people die a day waiting for an organ, and living donation can contribute significantly, and people can do it and live a good life and really make a positive impact. And here's an example of wife to husband, but it can be a friend, and we have people that just want to do something good
Sure.
for another person. And if we can get more people to do it, we can save many people's lives.
Do donors feel differently once they've donated an organ? And I'm sure spiritually they probably feel better, but
I think there's a spiritual positive, but you can comment how you recovered.
Feeling good?
I feel wonderful.
Yeah.
Because I knew I gave my husband 10 more years of life, if not more. But the good news happened like a week after the operation, and he said to me while the two of us are lying in bed, I've never felt better, Susan.
It's terrific.
That's like a week after the operation,
Yeah.
and I said, I did it. It's good.
Well, congratulations to the two of you and to you. We've got Susan and John Tiefenbrunn and Dr. Christopher Marsh from Scripps. Thanks for coming on the program,
Thank
sharing
you
your
for having
story.
us.
Congratulations. I'm glad it was a success. You're living happy lives.
Thank you.
Fantastic.